Welkom terug bij Pride TV Live, bij een blog van TransPride. Mijn naam is Brand Berghouwer en ik ga zo overschakelen naar het Engels. Maar ik ga jullie eerst nog even iets vertellen over de foto's die jullie achter mij en soms in het scherm zullen zien. Dat zijn foto's uit een fotoreeks Trans in Amsterdam, die vorig jaar gemaakt is door Transgender Netwerk Nederland. En daarin zie je 12 verschillende Amsterdamse transorganisaties langskomen. Dus dat zie je op de achtergrond. And then I'll switch to English, because today we're speaking about TransCare during Corona. And I have 4 very distinguished guests, whom I'm going to speak with about this very interesting topic. And I'm going to introduce them, or actually I'm going to ask them to introduce themselves, because that's easier for me. Alejandra, would you like to start?
Yes, thank you. Hello, everybody. Good afternoon. My name is Alejandra, and I'm 37 years old. I am a trans woman with a migrant, refugee, and sex work background, and I am part of Trans United Europe, which is an organization that focuses on empowering the lives of trans persons with a migrant, refugee, sex work background, and also persons living with HIV. And the organization has been around since 2013, started by Bionji Veldkamp and by Miss Ashily Dior, who is here also, and is currently led by Dina Bons, along with Bionji Veldkamp, Samira Hakim, and Sherry J. Everi, and myself.
Aha, thank you very much.
Thank you.
We'll hear more from you later on, but first let's introduce the other guest, Ashily.
Hi, it's morning, evening, midday. Good day, I'm Ashily Dior. I am also a transgender woman out of the Caribbean. I am a project leader with Prisma Group, Amsterdam. Prisma Group has been around for a while, but Prisma Group Amsterdam is just last year, September, we started in Amsterdam. And what Prisma Group is an empowerment group for bicultural LGBTIQ plus people, mostly with from the immigrants backgrounds, etc. Mm-hmm. And what we do, we try to provide empowerment assistance in terms of navigating the Dutch system for particularly migrant people. A lot of our clients are people who are still in the system, in the asylum seekers in that system. So that's basically what we're doing at this point.
Okay, well, get into that later on. Moreno.
Hi, my name is Moreno. I define myself as queer and gender fluid. And together with Anne-Leva Rushin, we created LHBTI steun, or LGBTI plus support in English. It's a platform that we created during Corona time, and it's support from the community, from volunteers for the community. Mm-hmm. And indeed, we created it especially for this time, but we want also to continue later on to support through phone and chat service. People can always call in. And also we have a lot of cultural online events that we organize through our platforms to connect all the community in the Netherlands.
Wow, nice. Kaye.
Hi, good afternoon. I'm Kaye Candaza from Filipino LGBT Europe. I'm the head of the trans committee, and my organization is based in the Netherlands, but it's a European organization which is built to connect Filipino Europeans. Mm-hmm. And our organization is built to help Filipino migrants, Filipino LGBTI undocumented, sex worker, and my work is more focused on trans Pinays and trans Pinoys and non-binary Filipinos living in Europe, and also helping undocumented Filipino migrants, which is, for now, it's not really my focus on only Filipinos, but also undocumented people living here who really need help and support. And my work for the organization is to have that 1 month support group meeting to help them with legal or social psychological help as well. And yeah, it's a broad work, and for now it's also helping Filipinos living here to get in connected and get in contact with other NGOs or organizations.
Okay. Were you already active before Corona as like the head of the trans?
Since
part?
the organization was built, I was the head of the committee for trans, and my work is mostly during the Corona and after. It was already a support group, but then it grows because a lot of trans people I know who are not only Filipinos but undocumented trans from Black POC background, who are sex worker and domestic worker as well, really are the affected community, because the issue of being undocumented and being trans is is so difficult, being undocumented and trans in the Netherlands.
Yeah, so you told me that it is very complicated to get hormones if you are here and you don't have documents. So that's one of the things you do. Can you tell us a bit about that?
The thing is, living here, even me, I consider myself as a privileged one. I'm a Dutch citizen, but I'm still struggling to get, to explore the Dutch society, how the protocol on trans affirming healthcare. I'm still struggling with that because it's so binary. It's so it's so outdated, like the protocol that we use on trans people. But it's much worse when you are undocumented, because it's all bureaucratic thing, like you have to go to a doctor or what. But for undocumented people, they don't have that. It's healthcare for them inaccessible. Like that's why 3 months ago, I started with Alejandra about it. I started asking for donation for hormones because most of these women I know are living here for years without access to trans-related healthcare, and most of them stopped taking hormones. They were undocumented. They were documented before and they became undocumented. So that means they stop as soon as their papers stop. They don't have their access to medical help stop as well. That means hormones. So, and they choose to stay in the Netherlands. And that's one of the reasons why I started the hormone donation project to help them have, continue taking hormones.
Okay, wow. Thank you. Ashily, you told us a little bit about Prisma. You were already active before. What are some of the things that you do for the LGBTI plus community and mainly for trans?
Okay, so Prisma originally started probably about 8-9 years ago, between 7 8 years ago, I think. And it was Prisma Utrecht. It originally started out as sort of a group with an Arabic background, basically, but it was really with Dutch people, Dutch migrants. Most of the people who were part of Prisma at the time were born here, but with Iranis, Pakistani, etc., backgrounds. And it grew. The work that they started doing was it was seen to be quite necessary, so it started to grow, and now it has evolved into something totally different with the influx of immigrants, etc., etc. Prisma saw the need to expand, and we started Prisma Amsterdam. Ishad Hussain and myself, well, he started it, and I'm now one of the project leaders for Amsterdam. And what we attempt to do in an event, or the services that we provide, psychosocial support, empowerment. We try to, every 3 weeks, we have one meeting, and that meeting is usually we have a
team.
No, usually yes, we have a theme.
Mm-hmm.
We have I'm losing my mind. We have we ask someone to come in to speak.
Okay.
A
guest speaker.
A guest speaker. Thank you. Oh my God. Now I am transitioning between English and Dutch. So I keep losing words.
I can imagine.
So anyway, we have a guest speaker. Every meeting we have a guest speaker, and we try to make the guest speaker is always someone bicultural. It's always someone who has risen to a certain place within the community, a certain level within the community. This is as an example for our clients to show, yes, you can achieve, you can grow, even with challenges. So our guest speaker usually give a bit of a history about themselves, their challenges as a migrant person, as an immigrant in the Netherlands, challenges that you face, and that you can rise still. Mm-hmm. So this is one of the ways that we try to empower our group, but we also look at the different issues that affect our group, and because our group is mainly people out of the asylum system, mm-hmm. we understand, me coming through that system myself, understand the challenges that they face. And we try to help them to navigate that system. A lot of the people come here from countries where being gay is definitely a death sentence. So when they come here and they are faced with dealing with these authoritative figures, we have IND, we have all these people in authority, white people in authority mostly, and then they ask them to tell me about your gayness. Mm-hmm. It's a challenge for these people coming from these countries where it's not okay to discuss or to talk about being gay, much less even appear to be gay, act gay. So there's those challenges that they face, being able to freely open up to even do the interviews with mm-hmm. Andy. So what we try to do is empower them to understand, okay, you're in a country, we can help you become comfortable with self. You have to first become comfortable with self. In the Corona period, however, because we weren't able to come together as a group, we started once a week Facebook Live. Mm-hmm. So we continued doing the very same thing. We had guest speakers on our Facebook Live. And we did a lot more psychosocial counseling. So what we did was every day we were busy on the phone, reaching out to all the different clients, calling, finding out how they were doing, and seeing in what way we can actually offer assistance. Some people was just to have a conversation. Mm-hmm. But we also found that for the trans community, it was particularly difficult because transgenders are generally isolated. So in the corona period, it just made it even more. It personified that isolation. And then there was a lot of panic for people who were not able to access hormones, medical health care, etc., etc. So what we try to do is create this network that we can refer to the different organizations that would be more, would have more information on that. Transgender, Amsterdam, what is it?
TransUnited
Amsterdam, that group.
They,
And,
yes.
So yeah, no, but yeah. So that's basically. I mean, we found that the challenges were a lot of transgenders were. Some of them just wanted to talk.
Yeah.
Because there are a lot of transgenders are in sex work, and even the ones that are not involved in sex work was also affected because it isolated them even more. And we're an isolated community.
Yeah.
We are still a community. Well, I don't even know if it's right to call us a community, but we're trying to build community. So we're people that is that's struggling for a community.
Yeah.
And I think there's wonderful work that a lot of the trans groups are actually doing right now in terms of trying to build that community. So I'm proud to be sitting here with this group of people.
Yeah. Thank you. That is a very nice bridge, actually, to Moreno, as you are trying to build community and give support within the community. Can you explain us a little bit about LGBTI plus support?
Yeah, indeed, especially about the trans community, we had also in mind how this part of the community is already isolated and how they would be even more isolated during Corona time. This is actually why I contacted Aneleva. She's working for TNN as well as Pink Terrorists. And indeed, I had in mind, okay, the people that are the most weak in this moment are really the transgender people and folks, a little bit older part of the community, or the younger ones that are still living with their parents and maybe they're not accepted. So many different problematics. And this is why I really asked her, like, we really need to create something for right now, for the lockdown. I am Italian myself. My family lives in the worst area in Italy, where we literally had camions of bodies going from the hospital. So I was very, very concerned. We were quite lucky here. But still, on a social level, there are a lot of difficulties. And in the future, we also think that there might be also from economic reasons. So we are definitely there, always on the phone and chat. Thanks to the connection with COC Netherlands and their support, we actually use the systems from Switchboard. And our volunteers have specific time frames for themselves. And even in our team, we are a very diverse team. We have people of all spectrum of the community. So they are indeed prepared also through Switchboard how to respond to different callers as well as transgender callers. And as well to refer to other associations or other information points if they ask information. Our first need was just to be there to listen.
Yeah.
And we are still there to listen. They can always write us on the chat or call in. It's the same number as Switchboard. You can check on our website, lhbtsteun.nl, all the time frames when they want to write us and contact us. And at the same time, we really felt very overwhelmed by the good response of volunteers. I had to, after the first day of opening, I had to close down the requests because we had way too many, and we still have a waiting list of volunteers that want to help on the phone and chat.
Wow.
And especially if, during the lockdown, but in the future, if there's going to be a similar situation or not, we are still going to be there, ready really to listen. And at the same time, I'm a choreographer and dancer myself. And we saw how it was important for everyone to have also enough lighting or entertainment or something lighthearted. Mm-hmm. And actually, we see even more the originality of our platform or an organization in this. How we can also not think too much about the negativity of the moment, but just to come together, have a Zoom party online. We organize now also free online workshops from artists and movement practitioners or dancers, etc., connected with thematic of Corona or not at all, or how to be able to move in your own home. So people who still are self-isolating for different reasons or health reasons. And even more in the future, we see that necessity to bring a little bit of lighthearted moments and help through online community, really. How we can connect through this amazing medium that is the web, through different platforms. And how even more we can connect different parts of the communities, because there is definitely urgency of everyone of the community to help and come together. And our platform also is attracting a lot of young-hearted, not so much young in age, but more like people who are present online and they are active online and they like that. Mm-hmm. And they are already very interested in connecting with the community and be there for everyone of the community. And as well, people of my age or even younger, we have also a very fluid understanding of gender and sexuality. So even though we are not transgenders ourselves, we can have at least a listening ear also for the transgender community. That's really beautiful, how people are coming together through the internet.
Wow, thank you. Alejandra.
Hello.
Trans United. Maybe you can start to tell us a little bit about what Trans United does in short, as the people who were looking at or who were watching the previous hour have already heard a few things, but maybe you can enlighten us a little bit about some of the activities of Trans United.
Yes, definitely. So again, Trans United it's been for a while, and since the past 2 years, we've been working on creating more activities and spaces for the trans community. We have done self-defense workshops. We have also organized empowerment workshops on how to feel comfortable with your body, because it's something that the trans community struggles a lot, to feel okay with you as you are. So last year we organized also a workshop on how to be comfortable with the body, but also with the voice. We understand that two things: to expect to change your voice to fit into the cis heteronormativity and the binary setting. It might not be for everybody, and it should not be expected of everybody, but some people from the community want that. So last year we did a workshop on voice training, which is also to be comfortable with your voice. It's not so much to change it, but to be okay with it. Besides the clinic, which we have every month, and now with the doctor even once a week, which is probably one of the biggest projects, we have also co-organized Transgender Day of Remembrance for the past 2 years. Correct me if I'm wrong, because it was started by Freer, who is here in the audience. And since August last year, we have been very lucky that the municipality of Amsterdam has provided us with a place for the trans community. And all this happened as a chain of events, because 2 years ago, we did a research among the bicultural trans community in Amsterdam to see what were the needs of the community, and the results were not shocking to us, because we know, but the results were shocking for the municipality, that many persons in the community are isolated, cannot access jobs, feel discriminated even in the bigger LGBTQI plus places.
Community, yeah.
Yeah,
Community
with the
spaces.
bigger LGBTQI community. So the consensus was, we need a place for us, and by us and for us. And again, since August last year, we have what we call Tea House, which is Tea-House, which is a play of words of trans house, but tea house, and yeah. And there we organize different activities. We have a Trans Tal Cafe. We have also, they call it a spreekuur, like to talk with someone from TNN related to legal aspects. And we also cooperate and all of these because we want to create a safe space for the community. We also have a project where people can donate clothes for persons that do not have access to them. And many times for our events, we also send letters to the SSS, so persons from outside Amsterdam can come to our events. Sadly, all this came to an end, and even more plans that we had and that we still have for when the crisis is over, which it isn't just yet. Sadly, all our events, the physical events, have to be canceled, and our main goal is to assist the community, our community, the bicultural, the sex workers, persons living with HIV. So in April, our co-chair, Dina Bones, and along with Hela D, she's a sex work activist, they started this idea of getting funds to help sex workers in need. And I'll tell you what, sex work in the Netherlands is very complex. It's not exactly illegal, but you need so many requirements to do it. And for trans persons, many times sex work is the only way and in which you can survive. I know Tori was here a moment ago, and she says that we can be astronauts, and I agree. We definitely have the potential. We can be anything, but many times the society do not let us be that. But going back to sex work, when the crisis started, many in the community lost access to their income. So the Dutch Emergency Fund was contacted by Dina, and we started providing first money, then gift cards, then money transfers for sex workers who did not have access to income in any other way, not by the government, of course, not by clients, because we were in a lockdown. And besides that, which we have done since April, we have also provided help with the hormones. The hormone prescriptions haven't stopped. The doctor Adri Van Diemen and Nikki, her partner, along with us, we have made sure to email them. Sherry J is here. She has done that herself to make sure people do not go without the hormone treatment. And we also had a few cases of persons living with HIV who got stuck in the Netherlands. not from the Netherlands, but got stuck in the Netherlands and could not access medication. And it's really wonderful that Samira and Dina and Beyonce and Sherry are very capable persons that knows how to help persons that need it. So we have also been helping persons with hormones, financial help, but also with HIV medication.
Wow, you've been really busy these last few months.
Yes, but it's also good for us because we've been stuck home, and if you don't stay busy, you also go crazy. So
that's an important aspect. Yeah. Ashily, you told me that you learned some things from this crisis and in how to better help the LGBTI plus community.
Well, I guess with every situation, it's important to learn. It's a growth process. But I think it gave us a better understanding of, as Prisma, facing this crisis along with our community, because we have a large trans community in Prisma. We have most of our volunteers are trans men and trans women. The two project leaders, the director is trans, so it's pretty much very trans orientated. And but it's given us well, at least I have learned, I have seen that there are, in some ways, there are this corona season has made me a little bit aware that, or made me think about it more in an event. A lot of transgenders don't particularly come out to groups, and there are reasons for that. As Alejandra said correctly, there's a lot of discrimination towards transgenders. A lot of transgender people don't feel comfortable getting out in public, going to groups. There are still a lot of transgender people that don't really feel comfortable being around gay people. Because for the outside public, you think it's one of the same, but it's very different. And for trans people, a lot of transgender people don't like to be around gay people because they feel most discriminated by the gay community. So a lot of them, if it's a group that has a lot of gay people, they don't really want to be around. But apart from that, they just don't come out as often because the confidence isn't there, because the feeling of safety isn't there. And that is not necessarily always something that comes from the outside. A lot of it is internalized. It is the system that messed with our heads and told us that we need to fit into a binary system. As Alejandra said, we need to talk, act, look, everything as the gender that we identify as. I have grown tremendously over the last couple of years. No, but I have grown. I've been living this way for the best part of 25 years. So I have a different understanding of myself, and that makes me more comfortable. But I've understood, or I've come to the realization that it's a really good idea communicating with our trans community or building an online trans community, because I think it's easier to access. I think they're more comfortable via telephone, communicating that way, because they don't necessarily need to put on the makeup and try to get the right clothing and navigate the public system. So they tend to open up a little more. It's also something, some amount of safety in speaking to a stranger that is empathetic, and you hear that person on the phone. The person sounds kind. It sounds empathetic, and they don't have to see me. They don't have to judge me. I can tell them what's really happening, what I really feel.
Okay, so you are continuing to use phone and online in your
looking
work.
into it, particularly where the trans community is concerned.
Cool.
We have trans clients that would not come to the group, but they would talk to us via telephone.
Okay.
They would reach out to us via the telephone to access different things. Even sometimes it's just information.
Okay, thank you. Moreno, how are you going into an uncertain future with LGBT support?
Well, it is indeed an uncertain moment right now. We don't know what's gonna happen exactly. For us, we are definitely want to always be there as well on the phone and chat. We really want to take care of the people that want to still stay home already now and in the future, and they would like to just indeed talk, and we are there to listen to anything they would like to talk about. There's not really a topic. Sometimes they feel like they need to start or ask questions. No, we are just volunteers. We are just listening ears. If it's a bad day, it's a bad day. You can talk to us. It's fine. No worries. We are not gonna judge. We're just there to listen. Of course, if they have information, our volunteers are also prepared to give other information. We also on the website try to list as much as possible other organizations and groups and online groups and help, so that we can provide that as well. And indeed also for the transgender community, we know they are already feeling isolated, and for them it is feeling safe sometimes to just stay at home and contact from home, and we totally understand. So we are there for them as well.
Okay, thank you. Kaye, you told me that you are really passionate about making the hormone supply for the migrant girls a bit more sustainable. Can you say a little bit about that? How are you working on that?
Because this help actually about the hormones, it should not be a one-time help. It should be continuous. Because for most of these women, they really need it. Because most of the people I help with are binary trans women. So for them, it's also, a necessity. It's necessary that they have access to hormones for safety reason and for work as well. And Corona is actually so racialized, and a lot of Asian trans people suffers a lot from this because it's branded as Asian virus or Chinese. And so we're fighting, two viruses at the same time, this xenophobia, racism, and Corona. So a lot of Asian trans people are targeted, not only the cis folks, Asian cis folks, but it's triple with undocumented trans people, because the fear of losing your income, like most of the trans people I know who don't have who lost their job, like most of these girls are working as domestic helper, sex work, and some of them are exploited by their host family because knowing that they're undocumented, so the host family use it as a way to tell them that I might report you to the authority that you don't have paper. Or, you know, like this case of being undocumented and trans and being a black POC is so complex. It's so, and we need to give them a voice, because Pride for so long we ignore their issues, undocumented or refugees people. So the project of hormones to me is, I hope Pride Amsterdam also should do more about it, that it should be accessible to anyone who needs it, and it should be continuous. Thank you.
Thank you very much. Time flies when you're having these very interesting conversations, but we're almost out of time. What I take from this is like, please, everyone who is trans, there is help. There is help. There are lots of organizations. We've now seen 4, but there are even more that are providing help and can help you out in all kinds of different situations. Please don't hesitate to reach out. I think that's, and I hope everybody here agrees with me, is kind of what we wanted to make sure that you know. Thank you very much. Hope to see you next year, because this was TransPride's last TV broadcast. Happy Pride and have a good day. Bye.
Thank you.